Very good evening, friends. A very warm welcome to all of you in this session. Today, we're going to learn one more remedy from fourth year syllabus. A short remedy, but very useful in practice. Specifically, whenever the headache is troubling you and it is not getting settled, vertex headache, very severe headache, and not getting settled, then think about this remedy. Is very important. Menyanthes. This Menyanthes I have used many times for the vertex headache. It is a very severe pressure over there in the head and patient feels better. Patient comes to you by pressing the head very strongly on the vertex and he feels better only in that specific thing, specific way. The headache starts specifically at the nape of neck, then it goes up and settles over there, and there is tremendous heaviness in the pressure in the head, and patient always tries to press it very hard. Second important thing with which patient approaches, patient says that doctor, I feel better by this. When I stoop, I feel better. Very important characteristic. Third important, most important concomitant which you must always look for is the coldness of palms and soles. Coldness of the extremities, coldness of hands, icy coldness of hands. That is always associated. And fourth important point which I used to look for Menyanthes whenever patient comes is whenever patient lies down, immediately it starts getting the cramps and tremors or trembling of the fidgety of the legs, but specifically it is more of the cramps which develops in the legs as soon as patient lies down. These are all very essential features with which this remedy one can confirm for the headache. I have used n number of times for headache only, but headache associated with all those specific things. So it is not just a headache remedy. You have to you must have that state of headache which defines the complete theme of it. So this is a wonderful remedy which will be very useful in your practice if you utilize it. Generally, I used to utilize 200 potency most commonly, very occasionally 1 m, but most commonly 200 is sufficient. Menyanthes, it is a bug bean. A remedy for certain headaches with intermittent fever. That is very important. Even Murphy has mentioned about it is a quartan malaria. This is the remedy for quartan malaria. Coldness of abdomen, twitching, sensation of tension and compression, fidgets and urinary difficulties in women. Fidgets means restless legs. That is very common and restlessness associated with urinary complaints and a diabetes. Then Menyanthes one must see. Head, the pressing in vertex, better by hard pressure with hand. Pressing head, pressing together pain. Wet pressing on brain with every step on ascending. That is another modality stage. Whenever patient was going upstairs, ascending, every step the headache is worse. Pain from nape over the whole brain, better by stooping and sitting, worse by going upstairs. Cracking in jaw and twitching of the facial muscle. That is another adjunct with the main chip complaint that there is a facial twitching is associated. Stomach no thirst at any time. This underline in your book that no thirst at all. Ravenous hunger passing away after eating little. Desire for meat. Sensation of coldness extending to the esophagus. Abdomen is distended and full, increased by smoking tobacco. Coldness of abdomen. Coldness is the characteristic of this remedy. Extremities, icy coldness of hands and feet. See, this given in italics has a significance. So it is not just a headache associated with icy cold and feet. Always make a habit of touching the hands and feet. Generally hands. Cramp like pain as soon as patient lies down, the legs jerks and twitch. Again, this is given in italic and it is the key of the remedy. Fever, coldness predominates, felt most acutely in abdomen and legs and tip of the nose. Modalities worse during the rest and ascending. So whenever patient is ascending upstairs, there is always headache. Better by pressure on affected part and stooping and motion. Relationship, compare the capsicum, specifically the jaw pain, pulsatilla, calcarea and phosphoric acid, sanguinaria for headache, phosphoric acid with diabetes. Antidote, camphora. Dose is third to 30th potency, but I used to use 200 more commonly because in acute state, whenever the headache is there and you have to settle that it is always patient susceptibility is high, 200 works better. Few doses of 200 are sufficient to tackle that headache. So it's very small remedy, headache remedy specifically. A vertex headache that you have to find it out over there. So that's all for today. We'll meet directly on Tuesday, not on Monday. It's not possible to attend or take lecture on Monday. Thank you and good night.